The second pathogenic cells that we'll discuss their drugs are fungi. Even though most fungi are not dangerous, but some types can be harmful to health. There are approximately 300 fungi that are known to cause disease in humans. Fungal infections can be mild, such as a skin disease, and some like fungal meningitis and bloodstream infections, which are less common, can be deadly. Fungi are eukaryotic simple organisms that grow as single cells or thread-like filaments. This figure summarizes the mechanisms of action of the antifungals that we will be discussing in this lecture. Similar to bacteria, fungi has a cell wall that surrounds its cell membrane, yet they are structurally distinct. Fungal cell wall is composed of monoproteins, glucan, and chitin. Glucan polymers that resemble peptidoglycans function in bacteria are synthesized by membrane-bound glucan synthase, which is the target of echinocandin antifungals. Most of the antifungals that we will be covering in this course target the cell membrane's ergosterol and the enzymes responsible for its biosynthesis. The last antifungal that we will be considering is eflocytosine, which is an anti-metabolite that inhibits DNA and RNA synthesis. The first class we will be talking about are the ones either binding to ergosterol, which are polyenes, or inhibiting its biosynthesis, and these are azoles and allylamines. Ergosterol is a sterol that resides in the cell membranes of fungi and is involved in numerous biological functions such as membrane fluidity and regulation, activity, and distribution of integral membrane proteins. The sterol content between mammalian cells and fungal cells is different. Whereas ergosterol is the predominant sterol in many pathogenic fungi, mammalian cell membranes contain primarily cholesterol. This difference in sterol content, along with the essential role of sterols in maintenance of cell membranes, made ergosterol and its biosynthetic pathway a primary target for most currently available antifungal drugs to treat severe human fungal infections. The structure of ergosterol differs from that of cholesterol by the presence of additional double bonds on the B ring and the acyl chain. Let's consider how ergosterol is synthesized and what are the enzymes that have been inhibited by the developed antifungals. The precursor from which sterol is synthesized is called squalene. Squalene is an aliphatic hydrocarbon. It first undergoes epoxidation via squalene epoxidase that can be inhibited by allylamines. Then the epoxide intermediate is cyclized to give the steroidal backbone, a process that is catalyzed by squalene cyclase. The resulting intermediate, which is called lanosterol, is demethylated via 14-alpha demethylase, which is classified as a cytochrome P450 enzyme. This enzyme is the target of the most commonly used antifungals that are called azoles. The demethylated intermediate then undergoes a number of modifications that converts it eventually to ergosterol. The first class of the ergosterol targeting drugs are the polyenes. The structural complexity of the polyenes shown in here indicates that these compounds are natural. The clinically useful polyenes, which were isolated from soil bacteria, include amphotericin B, nystatin, and natamycin. As you can see, these drugs are characterized of being macrocyclic lactones, yet the size differs among them. Amphotericin B and nystatin are 38-membered, yet natamycin is 26-membered. On one side of these macrocyclic rings, there is a lipophilic polyene hydrocarbon chain that is composed of 7, 6, or 5 double bonds that are either completely or intermittently conjugated. On the other side exists a series of hydroxyl groups. The last common feature that is also essential for their antifungal activity is the glycosilically linked deoxyaminohexose that is called mycosamine. This one has an ionizable primary amino group which, along with the carboxylic acid on the macrocycle, render these compounds amphoteric. Natamycin differs from amphotericin B and nystatin by having a trans epoxide and its lactone being alpha, beta unsaturated. The lipophilic and hydrophilic features of polyenes is what aids in binding to ergosterol and their toxic effects to fungi. The lipophilic part of these very potent agents bind to ergosterol and then they assemble to form porins that disrupts the osmotic integrity of the fungal membrane, resulting in leakage of intracellular potassium, magnesium, sugars, and metabolites, and then cellular death. The effect is similar with cholesterol, which explains the toxicity in human patients. However, polyenes are less toxic to mammalians since their affinity for cholesterol is much less than that of ergosterol. Amphotericin B, nystatin, and natamycin are not absorbed due to their high molecular weight that exceeds 500 Dalton and due to their asymmetry. The asymmetry of being amphiphilic molecules, meaning that they have hydrophilic and lipophilic sides, along with their zwitterionic character, results in poor aqueous solubility. Thus, when these drugs are used orally, it is for the purpose of locally treating oral and pharyngeal fungal infections. They are also used topically. Amphotericin B is used parenterally for treating systemic infections, but nystatin and natamycin are not because they are too toxic to be administered parenterally. The main side effect of amphotericin B is nephrotoxicity, because infusions of amphotericin B result in constriction of the efferent arterioles, leading to a drop in renal blood flow and a glomerular filtration rate. Amphotericin B is also directly toxic to cellular membranes of the distal tubules, resulting in wasting of sodium, potassium, and magnesium. The most commonly used antifungals are azoles. Azoles inhibit a key enzyme in ergosterol biosynthesis, which is called 14-alpha-demethylase. This enzyme has a prosthetic heme group that catalyzes the demethylation of lanosterol. To understand the necessity of the azole ring in this class of antifungals, we need to look at the mechanism of lanosterol demethylation. 14-alpha-demethylase, which is also called cytochrome P51F, belongs to the cytochrome P superfamily. But unlike cytochrome P enzymes, demethylase has a strong specificity to lanosterol. The heme prosthetic group in the active site is the one responsible of activating molecular oxygen. The enzyme's catalytic reaction consists of 3 steps, each of which requires oxygen and a reducing cofactor. The first 2 steps are typical cytochrome P450 monooxygenation processes, during which the 14-alpha-methyl is converted to methyl alcohol and further converted to methylaldehyde. And in the last step, the aldehyde group is transformed into formic acid and detached, accompanied with the formation of a double bond between carbons 14 and 15. In azole antifungals, the basic nitrogen atom in the azole ring, whether imidazole or triazole, inhibit the demethylation process by coordinating with the heme iron, thus rendering the enzyme incapable of oxidizing its normal substrate. This crystal structure you see in here represents the binding of an azole, which is a fluconazole with 14-alpha-demethylase. Notice the crucial coordination bond of the basic nitrogen in the triazole ring with the heme iron. As a result of inhibiting demethylase by azoles, such as voriconazole shown in here, ergosterol is depleted. But the toxicity associated with these drugs is actually mainly due to the accumulation of lanosterol and other 14-alpha-demethylated sterols in the cell membrane. This accumulation of these intermediates lead to alterations in the plasma membrane permeability, leading to leakage of essential ions such as potassium cation that leads eventually to cell death. Azoles can also inhibit hepatic metabolism via binding to the cytochrome P450 monooxygenases. Their azole rings can coordinate with the heme iron in these enzymes. This inhibition of the many isoforms of cytochrome P450 family leads to an increased plasma concentration of some co-administered drugs, which may lead to toxicity. As an example of this kind of drug-drug interactions, fluconazole increases phenytoin's plasma concentration. In regard to the structure-activity relationship of azoles antifungals, the basic pharmacophoric requirement is having an imidazole or 1,2,3-triazole ring that is weakly basic. The lone pair of electrons on nitrogen 3 in imidazole or nitrogen 4 in triazole, as we've mentioned before, is the one responsible for binding to the heme. The pKa of that basic nitrogen ranges from 6.5 to 6.8. As for the rest of the drug, which is bound to nitrogen number 1, SAR studies have shown that the most potent azoles have 2 or 3 aromatic rings, where at least one needs to be mono or disubstituted with lipophilic groups, in particular halogens. The potency is best when the halogen is a fluorine. These pharmacophoric features render most azole antifungals lipophilic with very poor water solubility. An exception is fluconazole. This drug has two polar triazole rings, which along with a hydroxyl group will render the free base sufficiently water soluble to be injected intravenously. Let's begin now considering all different members of azoles. They all, as you can see, have the essential imidazole or triazole rings, and a number of phenyl rings where at least one is mono or disubstituted with a halogen, namely a chlorine or a fluorine. The ones used for treating a cutaneous mycosis, which is a superficial fungal infection of the skin, hair, or nails, are clotrimazole and miconazole. Ketoconazole and itraconazole have good oral absorption, thus can be used orally to treat systemic infections. In fluconazole, the two polar triazole rings highly increase the water solubility, and fluconazole, as we've mentioned before, can be given parenterally. To further enhance the water solubility, a prodrug with an ionizable phosphate group was developed. This prodrug rapidly converts to fluconazole in vivo by alkaline phosphatases. Voriconazole is another azole that can be used orally and parenterally to treat systemic fungal infections. It has a greater binding affinity to the target enzyme, and it is active against fluconazole-resistant strains, thus it has a broader spectrum of activity relative to the azoles we've just covered. The last class of antifungals that interfere with the biosynthesis of ergosterol are allylamines that include naphthene and terbinafine. Tolnaftate also inhibits the same target, which is squalene epoxidase. Yet this drug is not considered an allylamine, but rather a thiocarbamate. These antifungals are synthetic, non-competitive inhibitors. Similar to azoles, toxicity is not only a result of ergosterol depletion, but accumulation of the substrate, which is squalene that affects membrane permeability. The high lipophilic nature of naphthene and terbinafine allows for topical use for treating skin fungal infections. Naphthane's absorption is very low, thus it's not effective to be used orally for treating systemic infections. Yet terbinafine's absorption is much better, thus can be used orally for treating systemic infections. The other class of antifungals that we will be talking about targets glucan synthesis. Glucan to fungi is what peptidoglycan is to bacteria. It is a crucial part of the fungal cell wall that includes also manoproteins and chitin. The fungal cell wall, as mentioned before, determines the cell shape and protects cells against bursting caused by internal pressure or adverse effects of the environment. Glucan is a homopolymer of glucose units linked via beta-1,3 glycosidic bonds and a few side chains involving beta-1,6 linkages. It is synthesized by plasma membrane-associated synthesis, which extrudes newly formed linear polymer molecules through the membrane into the extracytoplasmic space. Inhibitors of this enzyme would lead to depletion of beta-glucan, thus preventing resistance against osmotic forces, which leads to cell lysis. The known inhibitors of glucan synthesis are the echinocandins. These clinically used echinocandins, which include caspofungin, anidilfungin, and micafungin, are semisynthetic. By looking at the structure of these echinocandins, you can see that they are cyclic peptides bound to a lipid-like structure, thus they are classified as being lipoproteins. They block fungal cell wall synthesis by non-competitive inhibition of the enzyme beta-1,3-glucan synthase. Due to the large molecular weight of echinocandins, they have poor oral bioavailability and are administered by intravenous infusion. Fungal antimetabolites have only one member, which is fluocytosine. The fluorinated cytosine is a prodrug that undergoes metabolic conversion to 5-fluorouracil by fungal cytosine deaminase. Remember that 5-fluorouracil is an antimetabolite that, as we've discussed before, is used for treating cancer. The reason behind the safety of fluocytosine in humans is that it is selectively uptaken by fungal cells but not human cells, because it needs a specific transporter, which is cytosine permease, to enter cells. This transporter is found in fungal cells but absent in mammalian cells. Once in the cell and following its conversion to 5-fluorouracil, it undergoes further bioactivation to 5-fluorodeoxyuridine monophosphate that can bind to thymidylate synthetase, inhibiting DNA synthesis, and it is also incorporated into RNA, thus inhibiting protein synthesis.